Melanie Langille is an environmental scientist with a background in human health risk assessment and contaminated site assessment. Melanie began her tenure with the NBL Lung as the Director of Program Development, Environmental Health, bringing to the organization a strong science background with a bachelor's degree in biology and a master's degree in environmental science and a passion for knowledge sharing. Welcome, Melanie.
Thanks, Barb. Thanks for that introduction. Can you let me know if you're seeing my screen and hearing me okay? Barb, if you could just, I can't see the chat when I'm in this mode, so if you could just let me know.
Yes, we can see you
okay.
and your slides.
Great, thank you. So thanks everybody again for being here. I spoke to you all a few moments ago as we welcomed everybody here to this symposium. Like Barb said, my background is in environmental science, so this topic of air pollution, indoor air pollution, outdoor air pollution, the importance of clean air everywhere is something that I get really excited about, and hopefully I don't speak too fast. Let's get going. Go. So at NBL Lung, we recognize that that clean air is essential to good health. In New Brunswick, we're pretty lucky in that we often have relatively clean air, and air pollution at low concentrations is relatively invisible. But really, there's no safe level of air pollution. Every exposure increases your risk of developing long-term health outcomes. What's outdoors can also make its way into the indoor air. And also we bring all kinds of things into our homes that really, hopefully I can put this lens on it for you, represent indoor air pollution. And given that in Canada, we spend over 95% of our time indoors, that indoor air quality is really, really important. Start with some really basics. What is air? Primarily, gases, mostly nitrogen, good chunk oxygen. There's some CO2 in an ideal situation. These ratios are going to fluctuate whether you've got good ventilation indoors or not. And you may be quite aware of ventilation in schools is lacking in a lot of our schools in New Brunswick. The CO2 levels tend to be on the higher side, which is an indication of not having a lot of fresh air being brought in, which brings with it that little sliver there, the other. What is the other? This stuff. Humidity, water, particulates, particles. Large in the scope of air quality is things like pollen, larger bits of dust. And then fine particulates, we call this PM 2.5. Talk more about it in a minute. And these are fine particulate matter that tends to have other things stuck to it. Those other things can be volatile organic chemicals, phthalates or something that you may hear about in the media, nitrogen dioxide, ozone. What else is in the air? Viruses, radon. There's so much. We could talk all day about air quality, but I've structured this presentation to kind of have the most important players on a spotlight on. So from an outdoor air perspective, you may have heard of the Air Quality Health Index. This is a relative tool that allows consistent messaging about the air quality, the outdoor air quality, risk to health. This was developed in partnership with the federal and provincial health and environment departments. NBL Lung was at that table when the AQHI was initially developed, and we continue to contribute to that on an ongoing basis. Missing from this slide is the fact that you can access the AQHI on the WeatherCan app. It's also on the Weather Network app. So it gives you an indication of what the air quality is today, what's the forecast for later today, what's the forecast for tomorrow, and it's on a scale of 1 to 10. And each of those numbers in the AQHI has a consistent messaging for both the general population and the at-risk population. At-risk being those with respiratory conditions, other chronic conditions, elderly, and very young. One caveat about the AQHI, though, is that everybody is different. And so although the messaging at an AQHI, for example, of 3, that it's low risk for both the at-risk populations and the general population, you may find that you are dealing with patients that they notice that their personal symptoms are exacerbated. Personally, I have severe allergies and undergoing some diagnostic tests for asthma. I recognize that I feel way worse when the AQHI is at 3, which is relatively moderate in the big scheme of things. Another note on the AQHIs is based on the National Air Pollution Surveillance System data, and we have 6 of those across New Brunswick, so it's quite diffuse. And so it is a tool in the toolbox, but just because the AQHI says low risk doesn't mean that there's an absence of air pollution. In New Brunswick, we have, like I said, 6 NAPS, or National Air Pollutant Surveillance System stations. These are very high-tech stations that are located across the province based on air sheds. So there are areas of the province that are anticipated to have similar air quality based on the way that the air moves, from a meteorological perspective, how the air moves across our province. There are a number of other monitoring stations as well. The Department of Environment and Local Government does require a number of our industrial polluters to put monitoring stations at their facility as part of their approval to operate. And all of that data is available on the department's web portal. The data portal link is there. And then once a year, they collate all that data together into a report that's kind of a snapshot of an average of the air quality in our province over a period of time. So one of the major players in all of that air quality monitoring, and I had mentioned this a little bit before, is the fine particulate matter. So this is particles that are less than 2.5 microns in diameter. So it's very, 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 very small. The challenge with these particles is, one, there's lots of sources of them, which we'll get to later, but they travel very, very deep into the lungs. And one of our previous speakers had mentioned about a lot of lung damage happens in the deep, small airways, small passages in the lungs, and that is where this stuff can get. Not only that, it can cross the blood-brain barrier. We've seen a number of studies where people that were exposed to significant amounts of air pollutions are developing tumors in the brain, just right here where their nose connects in that part of the head. That's one issue. Primarily at low concentrations, we see systemic inflammation across the body, which just stresses the body systems out, not just lungs, but throughout. Certainly exacerbates existing respiratory symptoms. And again, like one of our previous speakers had mentioned about the aerosolized components and metal bits in vape fluid, lots of contaminants can get adsorbed or stuck to these fine particles. So they kind of hitchhike on there, and then all of those contaminants can make their way into the lungs, deep into the lungs. Sources of PM2.5 are many, and I could talk all day about PM2.5, but high level, a lot of your dust, house dust is probably on a larger scale, but there are components of house dust that would fall into the 2.5 and smaller range. Road dust, wear and tear from brakes and tires on the road. Primary source that I get concerned about is combustion. This can come in lots of different ways, so indoors and outdoors. If you're heating, with wood that emits PM2.5, diesel, really anything that you're burning. So home heating oil emits PM2.5 out the chimney. Cooking with natural gas stoves, that emits PM2.5 into your home. Any sort of engine that uses an internal combustion engine, so your gas car, your diesel cars, lawnmowers, those sorts of things. And last but not least, wildfires, significant source of PM2.5. Construction as well leads back to kind of the dust side of things. Agriculture, all those big fields open, you know, when things aren't planted, lots of dust gets kicked up, and much of that will fall into the very fine particle size. So at NBL Lung, we have a really interesting program that we've developed over a number of years, where we have set out into the wild a number of PM2.5 sensors, and these capture data in near real time. These are 1 hour averages. Hard to grab a screenshot of this map at this time. We started with just half a dozen or so of these that complemented the NAPS stations are the diamond shape. The circles are these small sensors. This is a snapshot as of yesterday, but we will have about 55 of these in the province by the end of 2023, thanks to a network of citizen scientists and most recently the provincial parks. So there will be the brand name here is Purple Air, so there will be a Purple Air PM2.5 sensor in a number of provincial parks here before the end of the year, and we're really excited about that. So that data enables us to have a closer hyperlocal monitoring of PM2.5 that is so very important to lung health. Here's some of the resources that we've developed for public education related to PM2.5. On the left, this is a mock-up of the signage that will go up in the New Brunswick provincial parks, and this will actually be a slider, similar to the forest fire index, that the park workers check the index and move the slider so that public visiting the site gets a recognition and appreciation for that risk. We'll do the same thing on the PM2.5 side of things. Right-hand side here, this is an interactive display that we have at Science East, which is a science center here in Fredericton aimed at children, that has a broken out Purple Air sensor, some tablets to explore the data, and lots of interactive information that we've also collated into a teacher guide, and we've done a number of these presentations in elementary schools across the province. Need to talk a little bit about protecting lungs during smoke events. The top picture here is the American Iron and Metals fire that happened recently in St. John. Below it is wildfire from Charlotte County earlier this summer. So there are a lot of opportunities for outdoor air pollution to affect our lungs. Interested in keeping an eye on the time. I'll not go through these one by one, but this is the messaging that NBL Lung tries to get out into the public whenever possible when there is a smoke event. So in addition to the outdoor air that experiences pollution and gets brought into our homes through our air exchange systems, through our doors and our windows, even just going in and out of your home, you're bringing that pollution with you. And then there's more inside as well. I'd like to spend a few minutes on radon. Radon is a naturally occurring radioactive gas. Thanks, Anne. I see your 5 minutes remaining. Leading cause of lung cancer in non-smokers. New Brunswick has the highest levels of radon in Canada, and that's based on our geology. It's based on the the bedrock that underlays all of our province. It emits radon gas. It gets into homes, and that radioactivity physically damages the lungs. So what this represents really is preventable lung cancer. And so if you take nothing away from this presentation other than one small tidbit, I'd like you to recognize the need to test homes for radon. Super simple. And they can be fixed. So there are retrofits that you could do to your home to take that gas that's coming up from the soil and coming in through cracks in the foundation, and you can exhaust it outdoors where it's not a problem anymore. We've found in our testing that as many as 1 in 4 New Brunswickers that come and test their home have levels high enough that Health Canada recommends doing this mitigation. It's super simple to do. It's just a little plastic puck that needs to be set somewhere in the basement or the lowest lived in level of the house, and let it do its thing for 90 days, and it will measure that radioactive activity. Ideally, you want to do that in the winter months because you've got all our doors and windows mostly closed up. Health Canada recognizes a number of certified laboratories for doing that sort of analysis. We have partnerships with one of them, so we can certainly get those radon detectors from us, or there's lots of other places as well. The important thing is that it's at least 90 days long to capture as much variability as possible to understand your risk of lung cancer here. Recognizing that there's not a lot of time left, I wanted to just briefly touch on some of the other things that we bring into our homes actually represents air pollution, fragrances and scented products, spray aerosol cleaners, spray air fresheners, many of those chemicals that are involved in either the propellant to make them spray, or in the fragrance to make them smell nice, or in the cleaning, the active ingredients themselves have a number of negative health outcomes, including disruption of the endocrine system, which is all the hormonally regulated body systems, and plenty of evidence out there that supports that use of aerosol cleaners in the home increases the risk of developing lung disease in children, and also in exacerbating existing respiratory symptoms. Certainly plenty of ways to reduce your exposure here, such as eliminating fragrances and replacing harmful chemicals with safe and effective alternatives. We have a great program right now where we have done all the research for you and put together a number of recipes for all of your home cleaning needs that use these safe, non-toxic ingredients that you probably have in your cupboards at home. Image on the right here is just the quick reference guide, but we have a number of individual recipe cards, all the research, the evidence base to support it in one-pagers as well. So link is there to explore at your leisure. At my 20-minute mark, but I'm going to very quickly, I can't do a talk about air quality without talking about climate change. So recognize that our changing climate is affecting our outdoor air. Longer and more intense growing seasons means more pollen, means more wildfires, means more of a whole host of air pollutants, and that hot, stagnant air gets trapped. The air pollution, rather, gets trapped closer to where we're breathing. So we're exposed to a lot more in this changing climate than ever before. Not only that, we're spending more time indoors. We're already 95% of our time indoors. It's starting to creep up even more. And as we make changes to do energy efficiency retrofits, we're tightening up our buildings, making them less leaky, less drafty. Well, that's trapping pollutants inside as well. So all the more reason, all the more urgency to increase that, or to decrease rather, that indoor air pollution. We have a number of resources for health professionals that make these links between climate change and health, not just lung health, but a host of health effects as well. And again, website there for you to explore those at your leisure. Snapshot of some of those resources includes one-pagers, includes videos, includes podcasts, run the gamut. We've been doing this program for a couple of years and are always looking for feedback on what other areas we can help provide resources in this area. And then a very briefly, save the date. NB Lung is really pleased to be the contractor for Health Canada for a Clean Air Day national awareness campaign. Clean Air Day the next one is June 5th, 2024. We will be celebrating air as the precious natural resource that it is and seeking to enable people to take actions to protect it. So stay tuned for that, and hopefully you'll join us in some Clean Air Day activities in June of 2024. With that, I'll wrap up. Like I said, I could talk air quality all day, but here are NB Lung's, all the ways to get in touch with us. We are on all the social media platforms of your choice, and any further questions or any questions that we can't get to in the Q&A, absolutely pop me an email. My address is right there. With that, I guess I can look at the chat and see if there are any questions, but I'm having a hard time seeing all of the chats. So maybe
you want me to read them?
Somebody can help. Yeah, that would be great. Thanks, Barb.
Okay. So there, one question is, and Charlene, there's no bad questions. I am curious if air fryers would emit PM2 particles as well.
Oh, that's a really great question. There's no combustion there. So I don't have the answer right on the tip of my tongue, but I would hazard to say, yes, it's going to aerosolize some of the oils that you're using. And with the air fryer, there's less of those oils. But I think it's a much safer alternative than say, a barbecue or a natural gas powered stove.
And the second one is actually not a question. It's just a very informative talk. Thank you.
Oh, thank you.
Comment. So we
Great.
still have a minute, so we'll just see while we're waiting to see if there's one more. Oh, and Charlene said, thank you for your answer. I got an email from Lana Randall, who's the Senior Advocacy Coordinator with the Canadian Cancer Society here in New Brunswick, and I work on committee with her, but she had a very interesting comment to make about the budget for New Brunswick. So the $3.3 million to NB Cancer Network includes an implementation of a lung cancer screening program. Yay! And the program will be fully rolled out by 2025. I just wanted
That's
to.
Excellent.
It is very. Now, right now.
Thanks, Barb. And one note, I did have a note here to myself that I overlooked, but I wanted to mention that we are advocating for that lung cancer screening program to be expanded to include exposure to radon as a risk factor for eligibility.
Right.
Working on some very preliminary research with the New Brunswick and the IRDT Information Research and Data Center to take the data from the radon test kits that we have facilitated here, the home radon testing, and putting it into a provincial database that links with all of the health information, so we can, and demographics. So we should be able to see areas of the province that have high radon, people have lived in those homes for a number of years, and start to target some outreach in those areas to recommend lung cancer screening, even if you haven't been a smoker.